If something negative happened, you had a young patient who developed colon cancer on the younger age of things, and you think to yourself, should I now be screening young people for colon cancer? And there's a cost to that, which is kind of interesting, but I think not as important. But there's a risk of perforating the colon if you do a colonoscopy, and you make those trade-offs based on the risk and the benefit. But you stop to ask yourself, all right, what happened? How bad was it? That's the first thing. If it was bad, then you say to yourself, all right, how much do I think that this bad outcome was a result of something that I did and could do differently? Because if the answer is not, yes, it's something I did that caused this, and I could do something differently, then you're in a very different place than if, there's nothing I could really have done, because there are things that you might have caused, but you couldn't do differently, right? Like if the way that the medical system is structured is to work 24 hours in a shift, as it is in some hospitals, and a mistake happens at the 23rd or 24th hour, the system has to change, or you have to figure out how to rejuvenate yourself in that last hour. That's a very sort of, error, or a different type of error than something else that might have been potentially reversible. So I'd be thinking about whether or not you can intentionally describe to yourself, with the help of others, did this problem result from something I did? And could I do something differently to do so? And then the last piece of it is, if I were to do something differently, what does that impact? What impact does that have on practice in general? Does that mean I have to work 12 more hours a day to make it happen? Does it mean that I entail other patients to procedural risks that I might not have done so before? So, example, if you decide to start recommending colonoscopies for younger people because of some bad outcome that you experienced, that would entail some risks.